Well, thank you, Mr. Chairman. Thank you for our witnesses for appearing before us today. So much that we could dig into, and I want to thank my colleague from North Dakota for basically teeing this up. So according to HRSA, 17 people a day are dying, waiting for an organ transplant, but of course this number fails to represent those individuals who were never allowed on the waiting list to begin with. So I know we've been in and out a little bit today, but I think this is something that should be addressed, and that is for those patients that have disabilities. And I had a particular situation in my district with one of my constituents, Zion Sarmiento, who was born with Down syndrome, and he was desperately in need of a heart transplant, but was denied by several hospitals, citing directly and indirectly that his intellectual disability devalued his life. He passed away at less than 4 months old since he was denied a heart transplant. This legislation is about holding the transplant system and its participants accountable to the American people where it serves, but we can't forget those that are also left behind in the process. So I would strongly urge my colleagues to support final passage of the House bill to end discrimination based solely on a disability, the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which passed out of this committee earlier this year by a unanimous vote. And I'm going to start with you, Dr. Cannon. In 2019, the National Council on Disability released a report on organ transplants in individuals with disabilities, which found that people with disabilities are frequently denied access. And that's a nice way of putting it. Denied access to organ transplants based on transplant centers of written and unwritten policies, excluding people with disabilities as candidates, and in some cases just outright refusing to evaluate a patient's medical suitability for organ transplants because of their disability. Does your transplant center or hospital have a non-discrimination policy that explicitly covers individuals with disabilities?
We don't have this policy explicitly, but I can tell you we will bend over backwards to do everything we can for a patient with a disability. The issues at play is we want to make sure the patient's going to be able to take care of themselves, that they have the support in place, and we want to make sure that we do that. We have extensive social work support to help patients provide support for themselves. We are 100% built around trying to help patients overcome the many barriers they face.
But Doc, why don't you have that policy?
We probably should have the policy written down. We don't have it written down because it's what we do day to day, and we believe in it. So I guess we haven't felt the need to write it because we do it, but you're right, that's an oversight. We should.
I would encourage you to do it. Would you commit right now to actually putting that policy in place?
Absolutely.
I think that the parents of baby Zion would feel better knowing that there was some progress in Washington being made on this. So I thank you for your commitment to that. Dr. Karp, same question to you. There you are.
Yes, I can tell you that I personally performed a combined heart-liver transplant in a patient that had Down syndrome, and I'm very supportive of this. I think our overall institutional policy is not to discriminate on the basis of disability.
Is it a written policy?
I'm sure it is a written policy. I can get it to you. I can't remember the last time I actually saw it, but I would be shocked if that wasn't a written policy of the university and the medical center.
Okay. All right. Well, I'd appreciate you following up on that. And I want to turn to a Florida-specific issue. Now, more than 5,000 Floridians are currently on the waiting list for an organ transplant, and 48 of them die every month. As we are hearing, this death is not because American organ donors aren't stepping up. They certainly are, but because of the failures of the taxpayer-funded contractors. Last month, there were particularly alarming reports in Vox highlighting the over 3 years, 7,000 that over the last 3 years, 7,000 Americans' pancreases, the organ that produces insulin, have been cut out from generous American organ donors, and the federal government does not know where they went. This seems to be a chronic, repeating issue in the federal government. Now, this week, I received a letter from a Florida woman who has been waiting 4 years for a pancreas transplant. You can imagine her horror when she reads reports like that the government has lost 7,000 pancreases. So we know that they're getting stuck in a freezer, but then we can't find them. This is absurd. Dr. Karp, Mr. Siegel, actually, you testified that many whistleblowers have come to you. Have you heard about this practice?
Yes, ma'am. And actually, I've shared with this committee a picture that I received from a whistleblower at an OPO, which was boxes of pancreases just sitting in freezers. And I can tell you, whistleblowers at that OPO, CMS tells OPOs that they need to recover pancreases for research. They haven't defined research. The joke at that OPO is that they're conducting research on the efficacy of garbage disposal A versus garbage disposal B.
Wow, that's disgusting.
I agree.
Dr. Karp, I have follow-up questions, but I will submit them in writing and would appreciate a response. Thank you, Mr. Chairman. My time has expired. I yield.